In today's environment in healthcare, it's extremely important that we have the support of our community in the form of committed donors to allow us to carry out our healthcare mission. There are so many things going on in healthcare and so many demands on the healthcare system and changes that are constantly occurring that it's almost impossible for us to fund all of our needs simply from the revenues that we generate from operations.
Given the demographics of our community here, having affordable, high-quality healthcare is essential, because what we don't want to do is be chasing people off to different directions. We want to make sure that people understand that for healthcare, Mercy Hospital is their destination.
Now, I have no idea how many 501c3 corporations there are that represent all the local nonprofit organizations. I would imagine there are hundreds. And it would be very difficult to try to support all of those organizations in any meaningful way. So I think what you need to do is you need to pick and choose, find organizations that touch you or a member of the family or something that hits your hot button, and then dive in and support them.
All of us feel that, and I'm sure it goes back generations, we want to make tomorrow better than today, and hopefully today was better than yesterday. And this giving to the hospital or just supporting the community in general continues that tradition in our family.
The passion of the board is again, it's because it's those kind of individuals that seek to, the foundation represents a vehicle for them to reach out in the community and to fulfill their commitment to give back to the community.
Mercy volunteers are extremely important to Mercy Medical Center because they are our community connection. They are the ones that are here at the front in the lobby desk. They are the ones that greet people as they come into the hospital. They're the first impression, so they're extremely important to provide our friendly first impression to the public.
I always had in the back of my mind that once I retired, I was going to do something as payback to the community, and I just have always had a spirit of caring and taking care of people, and so I thought volunteering for the hospital would just be a natural progression toward that goal.
I volunteer because I was involved with volunteers when I was injured 20 years ago as an amputee. They would come to my house and they would help me at the hospital. So that encouraged me to be a volunteer to pay back to society.
Normally you would think of a volunteer as being just helping people into a wheelchair or directing them to different departments to go to. But we are the first faces that most people see when they are coming into a hospital. And with healthcare reform, that is going to be critical to any hospital.
Donors need to realize that when they give $1 to the foundation, as small as the dollar may be, it's used here. It's not used at some other facility. It's not used in some other county, in some other city. That money is used here at our facility.
For instance, this past year, the foundation supported us so well for our stroke program. We've gotten it up. It's been accredited and is being used extensively. And again, that's a nice added service to our community that improves the quality of care for a disease or an event that a lot of people are going to experience, unfortunately. So we just provide overall better care.
One of those items that the board was passionate about was the stroke, and we recently got that through the stroke robot and the stroke certification. And so to continue that, then the foundation board members would do the stroke awareness run in partnership with the hospital and hospital staff. So again, it's a partnership to build awareness and to build the healthcare in the community.
The differences the donors make to the Cancer Center is directly affecting our patients. Our patients, a lot of the psychosocial needs that they have, We're able to have things such as support groups and navigating our patients through their journey of cancer care from the time that they're diagnosed to all the way through to survivorship. The donations are used to help patients get them through that journey step by step.
You know, it became apparent to us that there would probably not be a more important privately funded project to benefit this community during our lifetimes. And that's what really sold us on the idea of supporting the project, and we did, and we had a wonderful response from the community. And you can see the results right here in this wonderful $260 million facility with the state-of-the-art equipment. And every day, I feel comfortable every day healthcare delivery in this community gets better.
The presence is so much greater now than it was 15 years ago. And I think because of that presence, and the physical presence and the emotional presence of a quality hospital, people are more encouraged. And I don't necessarily mean more encouraged to give, although I'm certainly that's probably part of it, but I think they're more encouraged that they know the future's better. And Mercy is a part of a better future.